working here at Manochikitsa as a counseling psychologist from last 5 years. While I was growing up, I realized people around me, not even those who are close to me, not even my family, are many a times able to understand how am I feeling, how I was feeling. And it was same with me also, because something that I'm going through, something that is happening with me, I cannot just tell them because I don't know how they're going to feel about it, how are they going to react. And that is when I realized that there needs to be somebody who I can talk to without thinking about how the person is going to think about me. Is that person going to judge me? Is the person really understanding what I'm going to say or talk about? And that is when I started exploring the field of psychology. While exploring the field, I found my identity, my career in the field of psychology, and here I am providing or being the provider of something which is as important as any other health issue, which is the physical health or the social health. So psychological health is as important as any other health. Over the period of 5 years, dealing with almost 1,000 more clients, the most common issues that I have addressed are anxiety, sadness, loneliness, low self-esteem, lack of self-awareness, decision-making issues, lack of initiative, OCD symptoms, PTSD, especially arriving from the childhood issues, and a lot more things. And we don't know what is it that a person is bringing. So yes, my approach with the client always starts with, or mostly starts with, CBT, which is obviously the cognitive behavioral therapy, so that I can understand what the person is going through, what all are the things that the person might be holding back. And it also helps the client to get more deep into himself or herself, to bring in the more insight, to bring in more clarity of the issues, the problems, the solution that they might be holding back. Yes, apart from the talks that we do, there are so many other things that we do. For example, the behavioral change or the psychological change or the cognitive change. And this is something that I always prefer, that the client has the opportunity or the client has the chance to choose what, when, how they want to do it, so that the therapy is a therapy and it does not become a burden for them. In the first session, I make sure that the person is very comfortable. So obviously I talk to the person, I make them realize, I make them understand that this is a safe place, this is something that they can feel safe about. And this obviously is brought by giving them an active ear, an active listening, an unjudgmental mind, an unjudgmental perspective. Correct. Apart from that, yes, we talk about the things that they are going through, how they are feeling in this particular moment. At the end of the session, we generally talk about the goals of the session, how the person wants the session to proceed, how often the person would like to have those sessions. So this is how my first session with you generally goes. Because I belong to UP and I'm residing in Delhi, my language is somehow limited to English and Hindi. So yes, feel free to talk in English and Hindi, and obviously because we are Indians, we can very easily use the English, which is the mix of English and Hindi. So you are free to talk about in any of these languages. If you are unsure or nervous about the therapy sessions, Well, it is a very natural response towards something that I'm going to try it for the first time. So it's okay to feel that way. But I can tell you what exactly happens in the therapy. A therapy is a space where you feel free and comfortable to talk about things. The client, be it me, be it anybody who you are talking to, gives you that unjudgmental space, the free space where you talk about your thing. So, a therapy is a safe space for you to talk about your deepest feeling. If you are unsure, it's okay to give it a try. It's okay to give a try to something new. And if you're nervous, it will just take 5 to 10 minutes with me or with anybody who will make you feel comfortable and will make you feel like you're just talking to yourself and nobody else. So, give it a try. Let's normalize therapy.